Let's move on now. Ebola has killed at least 177 people and infected as many as 750 people in Uganda and the Democratic Republic of Congo. Earlier today, Uganda's health ministry confirmed 3 new cases. This includes a Ugandan driver who transported the country's first Ebola patient and a health worker who became infected while caring for that patient. A third confirmed case involves a Congolese woman who traveled from the Democratic Republic of Congo to Uganda earlier this month. Officials are ramping up surveillance, contact tracing and public awareness campaigns to prevent further spread of the virus. The announcement comes as the World Health Organization raises the risk level for neighboring Democratic Republic of Congo, that is dubbed the epicenter of the outbreak, to very high. Authorities have now banned funeral wakes in the heavily infected and affected Ituri province after tensions erupted between residents and the police.
An Ebola patient is less dangerous than a person who has died from Ebola because the Ebola virus is a living virus. When someone is ill, the virus lives inside them. You can only come into contact with this virus when the fluids of the sick person leave their body.
WHO officials say the outbreak may have circulated undetected for weeks before being identified, making containment especially difficult in conflict-hit regions of eastern DRC. United Nations Central Emergency Response Fund has announced up to $60 million to help accelerate the Ebola response in the DRC and neighboring countries. The epicenter of the outbreak is located in eastern DRC, near borders shared with Uganda and other neighboring countries like South Sudan. Earlier this week, Uganda suspended public passenger transport with the DRC, citing a high risk of Ebola importation because of heavy cross-border movement and trade. Citing concerns over Ebola, the United States has temporarily banned the entry of permanent residents who visited the Democratic Republic of Congo, Uganda, or even South Sudan in the last 21 days. The outbreak is linked to the Bundibugyo strain of Ebola, a rare form of the virus for which there are currently no approved vaccines or treatments. Ebola spreads through direct contact with bodily fluids and can cause severe bleeding, organ failure, and even death. Researchers at Oxford University say they are working with global partners like India's Serum Institute to make a vaccine as soon as possible, adding that clinical trials for the vaccine could start within 2 to 3 months.
So normally a vaccine will take some time to get made and get tested. So typically it will take 5 to 10 years. We don't have that luxury here. So what we're trying to do is do many of the steps that are routinely done, do it in parallel. So we are working as hard and as fast as we can, and we've got some great partners globally, the Serum Institute of India, our on-site manufacturing facility, CBF. So we are getting the materials that we need to make the vaccine at scale to the Serum Institute quickly. And we're hoping, if everything goes well, that we would have a vaccine that could be tested in 2 to 3 months.